Grab a small ball like a tennis or a pinky ball. Find the side seam of your pants. Feel for the bony protrusion there. That's called the greater trochanter. Lie with your bottom knee bent and the ball right on or near your greater trochanter. Open and close your hips using your top leg to generate gentle movement. Ease off if it feels too intense or find a softer ball. After 20 to 30 seconds or longer, roll over onto your back and place the ball right behind the side seam. Other leg is straight along the floor. Bring your knee to your chest and gently cross your leg across your chest diagonally and then open it the other way. As big or as small as you desire. Gentle, swishing, easeful movements. After 20 to 30 seconds, then lie on your belly, move the ball to right in front of the side seam and possibly down an inch if it feels like you are on sensitive spot or lymph nodes. Tuck your toes under you and use the foot to push your body along the mat. Turn your head to the side and try to find a space of ease, 20 to 30 seconds of rock. Come to side lying, both knees bent. Open your top leg to clam, then parallel your leg. Bring the leg back behind you in parallel, and then open the knee again to the sky like a clam. Pause for a breath. Parallel your leg and return to the center, hover. After 4 like that, bring the leg back behind you a few inches and open and close the knee towards the sky and towards the floor 8 times. Try not to sag your ribs like this or arch your back like this as your leg goes back behind you. If opening and closing the thigh is challenging, just as if do it. Give your muscles the instructions to do it even if your leg barely moves at all. If you need to, come to lie all the way down on your side. Come to sit with your legs in a Z position. If your back is hunched over like this, then please sit up on some yoga blocks or a stack of pillows so that you can get your spine more upright. Alternate hinging your torso forwards and feeling a stretch with leaning on your arm and opening your leg. If you are on blocks or pillows, maybe you don't lean on your whole arm, but rather your hand. After 8, hold the forward hinge and try not to use your arms to stay here for 4 seconds. Spine straight like this and not rounded like this. Your range of coming forward might be very tiny, and that's okay. Do this 6 to 8 times. In your belly, your knee is bent. It can be a little bit or a lot. Forehead is on the floor and hands are by your chest. Pull your thigh towards you so that your hips rock to the side, and then press them away and raise your head and chest a few inches off the floor. Lower your head and chest back to the floor. Repeat the leg and hip motion, and then repeat raising your head and chest off the floor 4 to 6 times per leg. Once again, how high up you get or how bent your knee is does not matter. If the knee bend is not working for you, straighten your legs, semi-roll over onto your side, pull your knee in towards your armpit, straighten it, roll back to your belly, and lift your head and chest off the floor. Come down to your elbows and knees. Your right leg is on the diagonal, the right palm of your hand on the floor. Let your hips sink off to the left, and then press your hips strongly to the right, turning them to face the right as you press your left hip inwards. After 6 of this back and forth motion of your pelvis, explore adding raising the leg up. You will press your hips to the right, keep them there, no shifting, and then raise your right leg a few inches off the floor or higher. Pause for a beat and then lower with control and repeat. Your hips will shift to the left, and then you will pull and suck them towards the right, and the leg raises up 6 times. Make sure your spine is not collapsing like this. Stay lifted through your center. When you are done with everything, rest in a comfortable resting position for a good 6 to 8 breaths. Please do not skip this step.